Loggerenberg here today, who is a sports and lifestyle medical practitioner at Longevity Lab. And her topic for today is exercise for inflammation and longevity. Dr. Celeste is a sports and lifestyle medical practitioner based at Mediclinic in Sandton. She previously managed an emergency unit for 6 years before transitioning into sports medicine, where she completed her master's degree in sports medicine at the University of Pretoria. Dr. van Loggerenberg has a strong focus on longevity and regenerative medicine, with a particular interest in exercise as a powerful form of preventative and therapeutic care. She is passionate about prescribing exercise correctly and strategically to support individual health goals. This commitment to precision led her to incorporate cardiopulmonary exercise testing into her practice, enabling patients to train scientifically and optimize performance, health, and long-term outcomes. So it's really fantastic to have you here. Welcome. It's really amazing to have a doctor look at pain and inflammation so holistically. So I'm really excited to hear what you have to say. Can we give her a round of applause, please? Thank you.
Thank you for that introduction. Okay. Hello, everyone. Okay. Okay, so I don't need to introduce myself. You've heard that now already. So I'm just going to move on. So when I talk about exercise, or when I see a patient with inflammation or for longevity, there's always more than just exercise. So the American College of Lifestyle Medicine has the 6 pillars of health. So when we look at a patient, we need to look at them holistically, and that for me is important. So as you can see, healthy eating, avoiding risky substances, social connection, sleep, and then exercise. I could probably spend a day talking on each of them. But for today, we're going to talk about physical activity. And I think it's important to make a mind shift from exercise to physical activity, because when a patient that is not active hears, I need to exercise, they think I need to go to the gym and spend hours there. But that's not what it is. It's physical activity. It's movement throughout the day. It's the small things that matter in the end. And I think there's a lot of patients of mine that will train very hard and they come for a reason. But then I have a lot of patients with inflammation or who want to improve their lifestyle to have longevity that don't know what that means or what does that mean for them. So just so that you know, the recommendation from the College of Lifestyle Medicine is 150 to 300 minutes of moderate exercise or 75 to 100 minutes of vigorous exercise. But again, what does that mean for you? Because my vigorous exercise and yours won't be the same. So I think for me, it's also bringing that into practice and making it almost accessible to everyone and adapting it to you. We're moving into a time where we need to personalize medicine, and for that we need tools. So just the link between inflammation and longevity. So I don't think this image shows nicely because they don't bring it out in too high quality, but it just shows that when we look at what makes us age, what makes you get older, and why people die when they're older or why they get sick, it's all about your cell metabolism, cells that should die that don't die, how your genes adjust, epigenetics, all of that. And in the end, that processes will go faster the more inflammation you have. So by decreasing inflammation, we decrease your risk of other health issues, but also we make you get older, more healthier. And all these processes, there's more and more evidence that we can use exercise in the right ways to improve all these processes and thus decreasing your inflammation long term. Okay, so I'm not sure what level the audience is at. I'm sure it's quite varied, probably from medical to non-medical. But this is a normal cascade that goes on in our bodies. So when we look at an insult, so an insult in my mind and when I talk to patients is anything from an injury, a surgery, to the toxins we get exposed to daily. We live in a time where everything is fast-paced, we're all under stress, that's all toxins inside our body, and in a very unhealthy environment, we constantly exposed to external toxins in the air, in our water, everywhere, and all of that causes an insult. It's our body's normal response to cause inflammation. So for those interested, that's all the inflammatory markers that we get in an acute reaction, and that's healthy. We never want to lose that. Because if you can't mount a response, then you can't heal. That's your body's signal to heal. But unfortunately, what then happens is we go into chronic inflammation. So that is when the body takes the acute inflammation either for too long or doesn't convert it into the chronic right way or stop it. And then we get a lot of people who have chronic underlying inflammation. So I see clients or patients with autoimmune diseases, inflammatory diseases, but then also just the general population that has this low-grade inflammatory process that's going on due to the day-to-day stresses. And the thing is, how can we get rid of that to prevent it from going into the chronic or the autoimmune or any of those? So, the benefits of exercise. So, as you can see on this picture, the exercise, they call it the polypol. When you do exercise, we excrete something called exokines. Now, exokines is cytokines, it's your IL-6, it is all the different, almost like hormones and proteins that your body then releases to adjust your body. So the aim with exercise in inflammation is to put your body under stress so that it can adapt and then protect you. But every patient will be different in their needs. So for me, where I target exercise is based on your need. So some people need to lose weight, but they need to lose fat because the fat is an inflammatory. Fat can be seen as an endocrine organ that will then produce inflammatory markers that your body needs to get rid of. And if you're not doing that, you will have more inflammation. But to lose fat, you need to do the right type of exercise. And that's one type, so we'll get to the types now. But we also need to build muscle, because by having more muscle and stimulating your muscle, you can actually decrease insulin resistance. And that is, insulin resistance is a sign of inflammation. So when we start talking about menopause, diabetes, all of that, most of it starts with insulin resistance. And if we can improve the way our cells use glucose, then we don't have the glucose spikes and our insulin sensitivity gets better. And that's by building muscles. And that's a different type of exercise. So I think the main thing with exercise or physical activity is to know that there's different types and how can we incorporate that for each person, but also to recognize what does the patient in front of me need. So this is from a study done on cancer patients. So cancer is also seen as inflammation. Chronic inflammations, the cells didn't die and they just keep on going and going and going. And what they then did is they looked at the specific types of exercise and how that affects the inflammation in cancer patients. So these are patients who already have been diagnosed with cancer and what it does. And what I liked about this study is that, so they actually looked specifically at IL-6, which is one of your inflammatory markers, but then they break it down. So we've got endurance exercise. Endurance exercise is the long walk, the long run. So if you're an athlete, that will be your 20 kilometers on a weekend. If you're not an athlete, that will be your hike or your slow walk, but around the block for an hour. So that's your longer inflammation. What that does, initially, you might feel more inflamed, but it stimulates your body to adapt to the inflammation and then to actually be anti-inflammatory. So that I see as my main anti-inflammatory exercise. Then we've got resistance training. Now, there's a big trend, and the people in sports medicine especially should know that America just brought out the new guidelines on resistance training because there was always the guidelines on aerobic training, but nothing much about resistance training. And the importance of resistance training, not only for lifestyle, but also for inflammation, is becoming important, because that is where we target how our cells use sugar. But it's also good for our mental health. So where endurance is good for the long term, bringing down inflammation, your resistance training is good for releasing lactate. Lactate is used in your brain, and that's actually good for your mental health. But what's coming out is that your resistance training and your HIIT training, those two, that helps with your muscles, that then help with brain, is it doesn't need to be as hard as we all think. When I tell you to go to the gym and do resistance training, you think you need to pick up 50, 100, 150 kilograms or whatever of your body weight, but that's not what is important. All these studies show that it's actually the light weights that can also make a difference, or just resistance bands. So adjusting it again for your client. Okay, so HIIT training, that spikes your heart rate and brings it down. So when we talk about VO2, I'll touch on that. But that's that intense up and down. And that is good for your vascular adaptability. And the better your vessels can work, the better you'll get rid of inflammation. And then the last one is also the chronic low endurance and the effects that has. Okay, so just to make it a bit more practical, because we often get lost in the jargon, but then how do I bring this into practice? So I didn't want to go into the detail of this patient's inflammatory stuff. I wanted to focus on the exercise, but I had a 19-year-old female. She was sent to me after seeing multiple specialists with severe vomiting, bloating, just generalized inflammation. I then worked with her over a year where we did genetic tests, we did drips for her. So really trying to bring down her inflammation and spending time with her to see really what's the problem. And every time she went to exercise at the gym, she would be tired for 3-4 days because that's her body's response. So on the genetics, we could see she over-responds to exercise. So telling her, the world told her, you need to train hard. You need to train harder to get fitter, then you're going to feel better. And every time she did that, she actually felt worse and became reluctant to go to gym. Eventually, in combination with the endocrinologist, we diagnosed her with mast cell activation syndrome, postural orthostatic tachycardia syndrome, and hypermobility. And there's a big link between them, that the inflammation causes that, or it's an over-inflammatory process. But then, to my surprise, the endocrinologist and the dietitian told her, stop exercising completely so that we can get rid of your inflammation. And I was like, no, no, no. I don't agree. And I then, in being able to do a cardiopulmonary stress test for her, could guide her to get back to exercise that's comfortable for her. So that's the personalization of exercise. So I can't tell her, go do resistance training, because she gets too sore. But if we start with the low intensity exercise, I could guide her. So okay, so that brings me just to give you a brief overview of what a cardiopulmonary stress test is. Now, it's not something you're going to find in every office. It's something you're probably going to refer for and then get back, because there's only a few of them in the country. But it's a very helpful tool for these patients that's reluctant to exercise. So basically what we do is I do a lung function, stress ECG. So I do a plain ECG, then I check that you do a stress, and then we do a stress ECG. While you're doing your stress ECG, I can also, with the mask, so that's me, I can monitor, we monitor your oxygen and carbon dioxide. So my husband always says, I must just say, it's what they do before they're allowed to fly. So the Maverick test, if you've watched Maverick, that's the test he had to do before he could fly. But then that gives me a lot of information about your lungs, your heart, and your muscles. And where is the reluctance to exercise? Is it your heart that doesn't want to work with you? Is it your lungs that doesn't want to work? Or is it your muscles that need strengthening? And then we can also see substrate use. So where are you burning fat? And where are you burning sugar? And where should you be training for you? So that's how I personalize my exercise programs. So, getting back to our case study. So, for this 19-year-old, so this is the results, part of the results I get when I do your CPD test. So, before I did this, obviously I did a resting ECG for her. And with the resting ECG, when she was lying down and she had to sit up to do the lung function, her heart rate went from 80 to 100 just from sitting up. So there I could confirm to her the POTS, because that is what POTS is the increase in heart rate suddenly, and she feels dizzy. But then she needs to adjust to that. So now, number one, I confirmed something that everyone just told her she might have, and she has thought might be in her head. I could clinically confirm that for her. Okay. But then when we looked at this, so it's a lot of information and it's overwhelming when you see it for the first time. So I'm going to quickly point out to you the important things to me. So VO2 peak is basically your fitness, okay? On longevity, I'll talk a little bit more about that. Hers was 31.9. A super athlete, someone that cycles, endurance, all of that, can go up to 90. Above 50 is where I like it in young people, because that shows me your vascular system is adapted well, your heart's working well. So for a 19-year-old, this is low, okay? So it's something that shows us her cardiovascular system is not where it's meant to be. Then it can also work out your metabolic rate. So this is your basal metabolic rate. So I can guide her in terms of her nutrition with this, because now I can tell her how much she's supposed to eat and I don't have to guess. But the main thing for me here was, if you look at a 19-year-old should have a max heart rate of 201. But she only had a max heart rate of 151 before she became intolerable of exercise and became dizzy. That means the world told her, your zone 2 is 70% of that. But that's not her zone 2. That's a normal 19-year-old's zone 2. Her zone 2, based on an aerobic threshold that I could test, was actually at 108. So now instead of training her for her low-intensity exercise, I could bring it down to 108 max heart rate, and she feels much better exercising, and she doesn't get the symptoms. So this is the graph. Again, very, very overwhelming. But so this is her warm-up, and then we went into her resistance. So then we give her resistance on the bicycle. So 1, 2, 3. I could get her to a third step. That is 90 watts that she could cycle, and then she was too dizzy. But because I could play around with the machine then, I brought her all the way down, back to her zone 2, and I showed her what it should feel like. So not only did she get the numbers, I can show her, stay here for 5 minutes, see how that feels. And her dizziness went away, and she was like, this is tolerable. Now I can go out and do what is good for me. And then this is probably one of my favorite graphs that I get. And to be honest, most people's zone 2 that I test, the general public, if I test, their zone 2 is lower than what they think. Almost always. So if you tell a patient, train in zone 2, it's not the heart rate you think it is. It's lower. They need to be able to talk but not sing while they exercise. That's a zone 2. So for most people, it's lower. But this shows me where you're burning fat. Now, all those patients that struggle to lose weight, there's 2 problems I normally have. They eat too little and they train too hard. Eating too little stimulates your body to go into starvation and actually lay down more fat cells. So you're constantly in a stress response. But training too hard, so this was her peak. She didn't burn any fat. So the black line here is where she burned fat. So the harder she trained, the less fat she burned. But when we brought her back down, she started burning fat again. So if you just focus on this black line, you can see slower exercise burns more fat. So in a patient with inflammation that needs to lose weight, training them low will help with decrease the inflammation, but it will also burn their fat. So now I've already brought 2 of the stuff down that causes inflammation. And then slowly we can add the other exercises as tolerated once the system have adapted. So it's a constant update of what they meant to do. Okay, on to longevity. So when I see a patient with longevity, for everyone, and I'm sure for everyone in this room, longevity means something different. And I think it's an overall problem because it's like one of these words that get thrown around. So whenever I do a longevity consult, my question to you will be first, what is your aim? What does longevity mean for you? And where are you now? Because to get where you want to be, we need to know where you are now. So just some of the things when we talk about longevity, health span versus lifespan. So not only do you want to get old, yes, you want to be 100, but you don't want to be 100 and lying in a bed. You want to be 100 and have no chronic diseases. Or at least, if you have chronic diseases, the people who get 100, 120 only start having their chronic diseases by 90. So it's important to, 1, pick up the chronic disease early so that we can manage it, or constantly having the discussion with your patients about preventing your chronic diseases and delaying the onset, because that is what's going to give you a healthy long life, because that's what we all want. I don't want to be lying in a bed at 80, not being able to talk or not being able to look after myself. That's not for me longevity. So my aim is being a fighting fit 85-year-old, being the 85-year-old that can still travel on their own and pick up their own bag into a carrier in an aeroplane. That would be my aim. So that brings you to your centenary decathlon. So what that is asking people, what do you want to do when you're 80, 100? What do you want to be able to do? Do you want to be able to pick up your grandchild or sit with them on the floor and get up? Well, are you getting up off the floor now? Are you practicing for your centenary? If not, then you're not going to be able to do it. Are you just sitting still? Well, that's what you're going to do when you're 80. But the sooner you start, the better. If you want, so set that life goals and train your patients to set that life goals of what do you want to do one day. And if you're not training for that now, you're not going to get there. So, and everyone's goal is different, and we need to realize that in medicine. Some people it's just, I want to be disease-free. But some people it is, I want to be the 70-year-old that does the hike still better than the 60-year-old. Okay, so there's some biomarkers of longevity. So this was a consensus statement just showing the multitude. So if we go back to that the second image of what affects longevity. So these are the things that they look at and that people agreed upon that shows us, are you going to get older? But for me as a doctor, it means these are the things I need to target in my longevity wellness patients, because otherwise they are not going to live longer. So if I don't know what to target, then I can't help them. But if I do, it helps a lot. The only one for me that's not in there is the VO2. So I believe VO2 is a good biomarker. The better your VO2, which comes into your, that's actually the next slide. VO2 comes into your cardiac health, but also your respiratory. And the better that system is, the older you will get. But it targets, can you walk far, can you move, what's your surgical risk? So in Brazil, they did a study on the population and they used a CPD to test people's VO2. So the blue line is people who don't move, so they're sedentary. And the green line is the active people. So they basically just compared them over time. And as you can see, whether you're active or not, your VO2 will decline. Every decade, there is a decline for men a bit later than for females. But no matter what you do. So the aim is to keep your VO2 as high as possible to keep your longevity, because that will mean a lot of your other markers will also look better. So I like this one, because if you look here, the oldest females are at the 10 years in front of them. So you're almost like 10 years younger biologically if you just maintain your VO2. Okay, so exercise and longevity, there's a lot of different theories, but there's a lot of research coming out. Cardiopulmonary health is important. So we need to maintain good cardio health. So cardiorespiratory fitness, decrease your admissions, decrease your illnesses. So again, if we go back to the types of exercise, when I see a patient for longevity, I've got three things. You need to do endurance exercise, you need to do HIIT training because I need to prevent your insulin resistance, and you need to do resistance training for your bones and for your muscles because we lose that. And I think it's the combination of all of those that in the end will have the long-term effect. So just quickly, so cardiorespiratory fitness is measured through maximal oxygen uptake. So again, I test that on my VO2. Our watches, all of that gives us a prediction. So if you have someone that has a watch, they will often say there, I must say, I don't think they're that accurate. But the other thing is, if you measure and you know, you can always just use the same measure because then your degree of being incorrect is the same. So just measuring with the same scale or measuring with the same thing and seeing improvement means there's still some improvement. Measuring your cardiac exercise zones, so the aerobic, anaerobic, where are your zones? Like I showed with the previous case, her aerobic threshold, so where she's in a zone 2, is much lower than what it was expected. That can help to guide the training. And I can tell you, where is your HIIT? Where do you need to try and hit your heart rate or your watts on the bike? And where is it really low? Because a lot of people train in zone 3, but then they're not getting all the benefits they want. And that up and down is what's important. And then also, I can't remember who said it, but you never see a 100-year-old that's fat. So weight loss and weight management is an important factor. So through doing the CPD, we can also guide them on weight loss and maximal fat burning training. So just a longevity case study. Sorry, I don't know how much time I have left. Okay, I'll be fine then. So I had a 69-year-old female. She first saw me when she was 68. She was already active, which was great. But she wanted to make sure. Her mom's 93. She's going to get old. She's genetically inclined to get old. But she wants to be able to travel, pick up her own bag, hike, cycle, yes, with an e-bike. But she wants to be able to do that throughout her retirement until she's about 85 at least, because she knows she's still going to live until 90-something. So then we tested her. So besides the CPD, so obviously I'm talking about the exercise, we do the bloods, we check the hormones, we check her nutrition, we spoke about all of those lifestyle stuff. But then on her initial CPD, we diagnosed her with asthma at the age of 68. Because she had this chronic cough, she didn't really know, and the scary part, she's in the medical field, and she didn't know she had asthma. So I started her on asthma treatment. So that brings you to early diagnosis, like send your patients for the stress ECG, send your patient for the blood test, send your patient for the pulmonary function, because there might be that underlying thing that you can easily treat to improve them. And then she had a low VO2. So we adapted her exercise. So we incorporated zone 2 training, we incorporated HIIT sessions, and also strength training. So strength training was very important in her case because she wants to hike, she wants to pick up a bag. But all of that also had an effect. So I retested her it probably was about 15 months after each other. And just in that time, she had a 33% improvement in her aerobic capacity. So her VO2 went from 19.6, which placed her at a very high risk for comorbidities, to a 26. And then her aerobic threshold, so that's her zone 2. So when you start with zone 2 training, it's slow, it's boring, and no one wants to do it. Because you really need to slow life down to do it. You need to sit on that bicycle, reading a book while you train. For me, a zone 2 used to be 50 watts. And anyone who sits on a stationary bike knows that's very, very little. So for her, it's hard. So you need to play with that. But through doing that, she managed to improve it, where her zone 2 was 64% of her heart rate max. It's now 74, which means now I can adjust her zone 2 to be a bit faster. So her zone 2 has grown, and she can do harder exercise in her zone 2. So look, I love cycling, so I always talk about cycling. So if you talk about the Pogacar, his zone 2 heart rate is 150. So he can probably go on my max speed and power output and still be in zone 2. And that's your aim, is if you grow your zone 2, it's easier to do zone 2 training because you can actually jog or you can actually cycle hard. But when you start, you need to start where you are meant to, where yours are, and that is slow. But it doesn't mean you can't improve it. So for me, the moral of the story of both these cases is it's never too late to start. But sometimes the patient just needs the right guidance to take those first few steps. That patient that's reluctant to exercise is because they don't know where to start, and everyone's putting the benchmark there, but their benchmark might be here. And if you start them there and progress them, they will actually be able to do it. So on that, I listen to a lot of podcasts. So yesterday I listened to one also quite new on activity in sedentary people and what is activity actually. And even 4 minutes a day of vigorous activity. So running with your child, running with your dog, just moving can have a benefit on cardiovascular health. So for those patients who struggle to take that first few steps, ask them to give you 5 minutes 3 times a week and build up from there. Okay, that's just the reference list if anyone wants it. And then if there's any questions. I don't know if you want to do questions afterwards.
No, we can do questions now. Thank you so much. Can we give her a round of applause? So we will be taking questions now. We have got a few minutes, and we've got a young lady there who will do her movement for the day and run around and give you the microphone. So can I get an indication? Are there any questions from... You have a question. Well, you're sitting right.
Hi. With the rising evidence for the importance of exercise in premenopausal women for better, longevity and stuff like that, I've noticed that a lot of women around my age are now starting to exercise for that specific goal in mind. So I had the question of, is there a kind of hierarchy for whether or not it's, the different training types? Like, is it more important to train for that loss of VO2 max or the muscle mass loss? Or, because I've seen a lot of disagreements about which one is more important if that is your goal for training.
Okay, so exercise for menopause is a whole nother chapter. And when you're young, you burn fat easily. Everything just goes easy. So I think up to about 35, for males and females, any movement is important. Whether you want to do strength training or cardio or whatever, you can probably do either, unless you have like an inflammatory disease, then I'll adjust it. So there you do what you like. But when you are perimenopausal, so in that age before you hit menopause, which can be from 35, and it's about 10 years before you actually hit menopause, strength training becomes more important because a lot of the runners, especially, so if you have an endurance athlete that doesn't do any strength training, you're not going to build your VO2 higher if you don't have the power to do it. So that's the nice thing with the CPET is because I check your power output as well, I can see if that's hammering you. And then I can say, okay, but you actually need more strength to be able to go higher. So I think they're all interconnected and each one has a role. So I'll never tell someone to do one thing specifically, but I'll look at what their combo is currently and adjust for where they are in life. But it is important to adjust for where you are in life.
Thank you so much for that. And coincidentally, tomorrow we will have a lady who will be talking about her menopause journey and started an amazing advocacy around menopause. So if you weren't planning to come tomorrow, maybe tomorrow the ladies in the house need to come and listen to that talk. We have a question here?
Yes, please. Thank you so much for the presentation. Just two quick questions. I'm assuming you are in a rural area and you don't have all the services for CPD and also maybe the affordability. And let's say you are a 50-year-old, active person, maybe you're into long distance running. How do you advise or how do you sort of encourage such a person to maintain their exercise or to keep on exercising towards their longevity without maybe exacerbating the chronic stress and an inflammation? The second question would be, would you maybe say if somebody who runs a 21K or somebody who does the Comrades Marathon, what are the scenarios there? Who's at risk for any long-term maybe illnesses and all that, or inflammation? I'm more worried about the longer you run, aren't you maybe putting yourself at risk for chronic stress and inflammation? Can you just explain a bit on that?
Okay, so for the people who don't have access to this, so there's a 6-minute step test that you can do. So you just need a 30 centimeter bench, and then you do basically for 1 minute you step up and down, and that should give you your heart rate max. So then at least you have an accurate maximum heart rate, and then you can work your zones from there from 60%, 70%, 80%. The other recommendation is to go on intensity level. So you need to be quite honest with yourself if you do it that way. But zone 2, so where you go out of where you're using oxygen, so out of your aerobic threshold, is normally where you can talk but not sing when you run. So a lot of people, there's a lot of research that is good enough. So there's like a definition in terms of breathing for each zone. So very easy is you can talk. So this will be exercise, but it's easy. And then if you go faster, but that's where everyone's will be different, because I have friends who run long distance and they can run at my zone 6 pace and then they still talk to me. So that's what I would guide them to. So then I would say, okay, go test that. And when you go out of that where you can't talk anymore, then you know you're in zone 3. And then zone 6, so your maximal, is where you cannot talk at all. You can't even do nasal breathing. So zone 2 also, you still need to be able to breathe through your nose. If you're out of that, then you know. So I would guide them with that. And then I would do a combination. Obviously, it depends on how fit they are, whether they need to start with just cardio, just walk every day, or do they need to do HIIT training if they're insulin resistance. And then if they don't have access to a gym and things like that, I use what they have in their house. So my older patients, the rule is you have a chair in your house. Every time you walk past that chair, you sit down and get up 10 times without using your hands, because that is already resistance training and it's a bit of HIIT. So if you increase your quads, then that's your biggest muscle, your insulin sensitivity becomes less. So, or 10 squats after a meal decreases makes your cells more sensitive to insulin. So that's the type of things I give to patients who can't afford to go all out or go to gym or have everything. So that's how I guide them. And then in terms of endurance athletes, there is definitely a point where you actually burn yourself out. So where inflammation goes up instead of down, where that point is will be determined by the person. So I also assist an orthopedic surgeon and I do knee and hip replacements. So we always have an argument because I feel running doesn't hurt your knees that much and he feels it does. But I don't think it's healthy for someone to run 100 kilometers, but I think a 21 is fine. If you don't have other stuff going on. So it will, for me, it's very much a personal, you base it on the person, because there's a lot of people. I mean, on Monday we did a scope for a patient, an e-scope for a patient that is 89 and he did 10 comrades. And his knee looks like better than some 50-year-old patients. Yes, he needed a scope, but he was 89. Come on, your knees aren't made to last that long even. So I feel it's very person dependent, and you need to see you need to listen to your body. I think we've stopped listening to our bodies. And with the endurance stuff, you really need to adjust your exercise for your body. And continue doing strength training, because the runners stop doing strength training and then they get injured.
Thank you so much. Did that answer your question? Incidentally, at the end of the day, at about 3:15, we actually have an OT talking about pain, which nicely connected with the topic on inflammation, and is a different angle. So if this is all fascinating to you, I would encourage you to try and stay to the end for that talk. I think we have time for one more question. So if anybody else has a question, no, we good? Okay, well, thank you so much. I think my big takeaway from what you spoke about is that medicine should be personalized. There's no like cookie cutter, there's guides, but you kind of have to personalize to the individual. And so I think that's the takeaway we should all take, away from this as health professionals. But thank you so much. We have a little token of our appreciation here. Can we give her another round of applause? Thank you.
Thank you.